So the CVT program, we learn how to do echo and vascular ultrasound through in-person instruction as well as hands-on experience in the clinical setting. We're exposed to so many real-life opportunities and are able to really see what echo and vascular ultrasound is all about through this program.
So we have a lot of different preceptors at all of our different clinical locations, and what that means is these are people who are registered in either cardiac ultrasound or vascular ultrasound or both. And so we get to, at first, it's a lot of us watching them and seeing the workflow and how they do their job on a daily basis. And as we go throughout clinical and they see what our abilities, then we're able to scan the patients and they're able to watch us and provide feedback and tips and tricks on how to become better.
Whenever I came into the program, I didn't have much patient care experience, and I truly feel like now I can really show my patients compassion and kindness and really know how to work with patients.
For myself, I've had a lot of growth as a person to know, educationally and personally, that you go through many trials and tribulations. It really helps you to grow and know that if you push yourself hard enough, you can keep growing and keep going.
We learn so much about the cardiovascular system. We learn how it works, why things happen, how to take images of it, what kind of treatment is going to be done as a result of the images we've taken, so we really see the whole picture.
Patient care has always been a thing for me, but I think it's gotten even more. I really like to look at the overall patient. With this program, I've gotten to just take a step back and actually meet the person before you meet the patient.
You're held to such a high expectation here, and with that high expectation, they're continuing to push you. Leadership is such a big deal, and I didn't have that previously. Making your own definition of what leadership looks like to you, whether that's working with a team or being a role model to others, I think they set us up really, really well.
There's only 7 people in our class, so we have grown very close to each other. We have long days together junior year, and then we see each other a lot senior year, whether it's in clinical, in class, or outside of clinical. We've all become very close.
With our instructors, since there's only 7 of us and there's 2 primary instructors, we really get one-on-one time with them, and they're like our moms. They genuinely care about us and want us to succeed and know our strengths and our weaknesses and how to push us to be the best.
I would say definitely the most impactful experience I've had is just the way that the instructors really care for you and are there for you through not only just school things that may come up, but also any personal issues. They're always there to help you get through it, and they're your biggest supporters and just want you to be successful. So that is probably what stuck out to me the most.
And it's helped me in just the sense that I have all this clinical experience, because a lot of people going into med school, they've never really been with a patient. They don't know how to treat a patient.
One way that I want to impact patient care is spend more time with my patients. Throughout this journey, I've noticed that patients really appreciate that little extra mile. I want to be that person that patients remember in a good way.
And I think just making the patient feel the most comfortable they can with having something done in the hospital, which can be a very vulnerable experience, is a great way that we can impact the medical field and just making patients feel like they're cared for.
The CVT program has just offered so many opportunities to be able to see different things in our clinical settings.
The CVT program has fully prepared me to work in the cardiovascular ultrasound field, so I feel fully prepared to be able to do full echoes and vascular ultrasounds by myself once I graduate.